Okay, good afternoon, everyone. I'm Tasani from Thailand. Because I come alone, so I can be Miss Thailand Universe today. The most beautiful Thai in Wisconsin. Cause where my camera on my table. If it's not beautiful, you can delete and then take again. Because it's evening and it's the time that I gonna wake up in my country, 3:30 and something. Because I'm working in faculty, so I will share with you about the field training for public health profession to prepare them to be able to do the community health development. So lesson learned from our faculty. But I will talk a little bit about Thailand and my university, and after that I will talk a little bit only about field training. After that I will show you the video presentation for our field training, and if you have any question and don't want to go back home, and you can ask me because evening already. Okay, for anyone who I never go to Thailand, but I think that you may heard about us in the breaking news last week. There are so many breaking news. So don't worry, that is just only one bomb, not just only one bomb. Don't worry about that. I can see here. So we are there, and if you go to Thailand now, you are quite millionaire because nearly 36 per dollar only. Now 36 baht per $1. Yeah, it because China collapsed, so make Thailand poor. This is we have many beautiful and historic places throughout our country. You can visit there. If anyone help me to use the QI to improve my work that I cannot talk, you go there. I will make a red carpet for you. You will really great guest for me. Okay, we are land of smile, so you will see Thai people always smile. And our nature, you will not hear. When you talk with us, you will not hear, oh, really, exactly, wow, oh, awesome. No, we just smile and like this. Okay, so would everyone smile to me? That is. Okay, let's go to my university. This is very old, and we have 6 campuses and so many faculty and institute. And His Royal Highness Prince Mahidol of Songkhla, it means the father of the present King Bhumibol. He is the father of modern medicine and public health in Thailand. He gave a great direction of working for us that true success is not in the learning, but in its application to the benefit of mankind. So we use this direction to conduct our field training as well. This is our office. I work in Faculty of Public Health in Community Health Department. We have altogether 13 departments. In Thailand, we have so many departments. Some subject is overlap, but we happy. Now we're happy to do like that. Okay, let's talk about field training for public health profession. It is our best practice, or you can say that good practice. I can say that it is only one institute that can conduct the field training in this model. This is the multidisciplinary team. Like an interprofessional work together in the field, but this is we prepare for a student to work in the community. So it may be useful for anyone who work in your university or anyone who will train your health profession to work in the field as well. Our field training conduct because we medical doctor, they have hospital, so public health, they should have the field to practice as well. And knowledge only cannot work in a real situation now because it's quite complex. So we need our students to face the reality situation. We first start on 1958, but at that time we focus only on specific professional skill. Let's say nutritional student go to do work in nutritional area. Environmental student go to build the toilet, latrine, or water tank or something. But after that, we conduct the name that we call comprehensive rural health development field training. Very long. Let me talk. We for short we talk 6 week field training because it take place 6 weeks consecutively in 1965, and it is the requirement of all students in our faculty. It means they join the field training based on compulsory basis. If they don't join, they don't graduate it. And this is the great opportunity for both lecturer or professor and student to work in a reality situation. We conduct a learning experience in real situation, and then we facilitate the student to have a skill of community health development to solve and assess community health problem based on participatory learning with the people in the community. We encourage them to work as a team with various health professions and with community as well. And after that, we want them to integrate their knowledge into the local wisdom. So the people in the community that the field training take place will get a little some. I can take only some because it is a short period, so better health and quality of life. To do that, so we train our students that in one community or society they comprise of many subsystems, and health is only one. So if you want to study about health, you need to study other sector beyond health as well. Or if you want to improve health, you need to improve other subsystem as well. So the program conducted should be what I can say an integrative program and need involvement or engagement from community. That is, we talk to them. And in the past, when the health profession want to improve health of the people in the community, most of them go to the community and collect the data as they want. After that, go back to their office and then sit only them or among their group to identify the problem and to do priority setting or making plan or project and activity. So the health profession, they do by their own. After get everything and then go back to the community again and then try to force the community to work or to participate. I can talk that it is the passively participate. You know? So you will see that at the beginning it quite work well, but in the long term, everything is not sustained. So how could we do, especially in this transition that we face double burden of the disease? I mean, non-communicable disease quite a lot. Then, diabetes, hypertension, but the infectious disease still there. We have so many dengue, hemorrhagic fever. We have a lot diarrhea or diarrheal disease. So how to do? We need to address the different perception between health profession and the people. Like we wear the color eyeglasses, different color. We see same community in different color. How to have the same picture? We need to encourage them to have a shared vision. Have a shared vision that is come to our model of field training. So we encourage the student to analyze the situation of the community. After that, analyze about the stakeholder and identify the stakeholder and let them and involve organization to think about the future, what they want their community to be, what they want their people to be. After that, make it clearer by set up the indicator and then compare to the current situation. The gaps the gaps are the problem that we need to improve. After that, work together until we meet the desirable situation through participatory learning process. Okay, so this need a well-designed, well-prepared, both in the academic preparation and have to talk with them how to share, how to learn, how to conduct a meeting with the community people. Is not that easy, but they need to learn and then practice in advance. So the field site, every year maybe around 18 teams. Students will divide it into 18 teams, now 18 teams. Around 400 students a year, comprised of, in some year we have doctoral degree. So doctor, dentist, pharmacist, nursing, nurses. Bachelor degree, we have nutrition, environment, community health, occupational health. So there are many careers of the student, and we have the medical student from other university as well. And the lecturer, around 40 lecturer take turn to supervise in the field. This is a multidisciplinary team. One team around 20 to 25 students stay in one village, working in one village. Before that, we have to establish many organizations that is me younger, a little bit younger than today. Today I cold, so look older because cold weather. Actually younger than this. Okay, this is an important one. When we are looking for the field site, we need to go to the top administration. So I go to talk with the province chief, or we call provincial governor, and provincial chief medical officer to select the field site. I talk with them what they will get from our field training. Talk to them and then let them choose the site to me. After that, we talk to the villager. We go to the village, talk with the village chief to prepare the house for the student. We ask for free. We don't give them money, just only for electricity only. But that the student will come to your village. What you will get? What will help you to work better? What about your health of the people? Tell them, and then ask for 1 or 2 houses per village to let the student stay together. We don't let the students stay 1 or 2 students in a house. No, because we want to let them have a team building, work together during night, and then supervisor easier. So we 1 or 2 house in each village, and we also conduct a meeting among the personnel in the field site to let them know our objective and let them know their role in the field site, how to support our students. This is we prepare for our student material. We have sleeping bag. We have the cookware for them, internet. If they don't have in that village, so we install temporary internet for them, and we have 2 or 3 bicycles to use in important job only. Okay. After that, in the second semester, we prepare them in the institute every Wednesday afternoon. We prepare them and prepare the lecturer as well. Talk with them about the concept, the principle, and let them analyze the data that we got from the field site to let them see the picture of the village, and then to let them get to know each other. We do in the institute, and after that we go to the field site. So the field site will take place 5 weeks. Altogether, we claim in institute training as 1 week. So altogether 6 weeks. That's why we call the 6-week field training. So I will show you how they work in the community.
Mahidol University's Faculty of Public Health Comprehensive Health Development Training Program, a 6-week field training course. In its curriculum, Mahidol University's Faculty of Public Health has always stressed the importance of developing personnel for the public health service who are able to work in a multidisciplinary comprehensive health development training program, a 6-week field training course. In its curriculum, Mahidol University's Faculty of Public Health has always stressed the importance of developing personnel for the public health service who are able to work in a multidisciplinary, interactive team environment. Over 3 decades ago, the faculty introduced a field training program in rural health development entitled the Comprehensive Health Development Training Program to be directed at students from all disciplines. The objective of the program was and continues to be to develop rural health development skills using a multidisciplinary approach to the problem-solving process to assess rural health problems and subsequently develop solutions. During the latter part of each academic year, comprehensive health teams of 12 to 15 undergraduate and master degree students from every discipline, led by an MPH student, are assigned to live in a rural village for a period of 6 weeks. Approximately 200 students and 50 faculty staff members participate in this training program every year. When the Comprehensive Health Development Training Program first began 3 decades ago, the field training component was based on the concept of using the rural community as a laboratory for the public health students. While the students were the major actors in each step of the problem-solving process, the community people were only passively involved. In the late 1970s, with the declaration of Alma Ata, the concept that community participation was necessary for health development became part of the consciousness of the public health community. In accord with the changing philosophies, our present dean, Dr. Porapan, led the 6-week field training program in a new direction. A new dimension was introduced to the program whereby the community members would play a more active role and were now encouraged to express their concerns. The villagers now were involved in the problem-solving process, especially in prioritizing their own problems. In 1994, the major principles in the Comprehensive Health Development Training Program were again reconsidered, and the program was shifted toward a new public health concept. Instead of using the community as a laboratory, the concept of using the community as a center for learning was introduced. With many lessons from past experiences, the Faculty of Public Health proposed a new model where the stakeholders, community people, students, and other partners all participate together in the decision-making process at each step in problem solving. This model, based on a participatory problem-solving concept, was entitled PLD, Participatory Learning for Development in Health. Since that time, the students have used the PLD model as their guide for working with the community during their field training. In brief, the steps of the PLD process are as follows. Step 1. Collecting community data and information. Here, the students gain an understanding of the general conditions of the community, including the culture, demography, economy, and available resources, using observations and the existing sources of information through such means as looking in hospital and health center records, learning the history of the community, and mapping the community. Using an epidemiological framework, the students will try to assess the existing sources of information, identify the stakeholders in the community, identify risk factors of the community, imagine possible problem scenarios, and propose a draft of these problems, using the web of causation to hypothesize about how they are interrelated. Step 2. Envisioning an ideal community. Stakeholders are invited to a meeting with the students to brainstorm what their ideal community would look like in terms of health. With student facilitators, the villagers are encouraged to cut and paste newspapers, draw symbols or pictures, write words, and use any other creative means to come up with a picture of their vision. Sometimes, the community members are split into smaller groups. When their pictures are complete, the villagers share and explain their vision of the ideal community. Step 3. Analyzing the main components of the community's desirable image. The community people and the students then work together to break down the pictures into their major components to be able to see the vision more clearly. The main components of one community's desirable image might include always having clean water to drink, clean streets, everyone exercising, and wanting everyone to have happy families. In a later stage, these components can be used as a framework to look back at the reality. Step 4. Identify indicators of the major components. During this stage, student facilitators encourage the stakeholders to think of the concrete measures of the major components. For example, if one of the components was that the community members wanted everyone in their village to have a happy family, they might decide that a happy family is one where father, mother, and children all live together. Step 5. Assess the current situation of the community. During this crucial part in the PLD process, the students and villagers meet together. The students present the quantitative and qualitative data that they collected during the first phase up to this point. The villagers present their perceptions of the current health situation. These two perspectives are merged together to produce a picture of the reality of the current situation of the community. Step 6. Identify and prioritize the major public health problems. The students and the community will then analyze the gap that exists between their vision for the community and the reality to identify the major public health problems in the community. The students work with the community to try to discover how these problems are linked together using the web of causation along with local wisdom as the major tools. Next, the magnitude, severity, and community concern about these problems, as well as the feasibility of solutions, are taken into account in order to prioritize these problems. Step 7. Participatory planning and program implementation. Next, the students and community people will brainstorm on solutions to the problems that they had agreed upon earlier. Then, the team will discuss whether those proposed solutions have taken into account the availability of resources in the community and if they will have an impact on the public health problem as a whole. The villagers and the students will work together to plan the programs. This includes assigning actors responsible for the implementation of the projects, deciding on the time frame, and considering what resources are available and what support is needed from the outside. Usually, due to the time limitation, short-term activities will be implemented to help the community see how to work as planned. Moreover, the students will help the community to begin mobilizing their available resources to be used in the programs in order to achieve long-term sustainability. Examples of the students' fieldwork program activities include waste and environmental management through a cleanup campaign involving the entire community, empowering the community through information distribution on such topics as malnutrition, dengue fever, and hypertension, and training community members to be trainers in aspects such as physical exercise. Step 8. Evaluation of the programs. As the time is limited, often pre-tests and post-tests are given to the community members to determine if the programs were effective. The stakeholders are also encouraged to assist in the evaluation through group discussion and individual verbal feedback. During this stage, the students and community members will also determine what additional outside support is needed, and the students will convey this information to the appropriate source. Upon completion of the field training, using the PLD model, all participants see how an integrated process involving many sectors maximizes the mobilization of resources within and outside of the community, thereby effectively and efficiently identifying and solving community health problems. As the students will have integrated and applied the theories first learned in the classroom, they will also see the importance of working as part of a team of public health workers and community people. With knowledge and experience gained in the classroom and through the field training experience, the Faculty of Public Health feels that our students are prepared to become partners and leaders in the communities in which they will work. We are proud of all of our alumni who are not only invaluable to the community, but also make significant contributions in helping us to expand and improve public health training and development. Mahidol University Faculty of Public Health Comprehensive Health Development Training Program, a 6-week field training course.
Where's my now? Okay, so what went right? It's done every year. And the number of the student increase every year. As you heard in the video, only 12 student a team now go to 25, and the number of team go to 18 teams a year, and will be increased because of number of the student increase every year. And what went wrong? There are so many, especially in academic supporting system. Some lecturers are not satisfied going to the field training because they may not cannot leave the home for a long time. Not as our team, we stay there for 6 weeks, never go out of the field because during night, if there is any urgent event occur, we need to solve the problem immediately. And next move, our university will do what we call the interprofessional education. So we plan to do this program start from the first year student in the whole university. I mean, many faculties to let them know how to talk with the community, how to make a team building, how to talk to each other. And the second year we will have next step. Let's say second year will have ability to do the community assessment, and third year maybe have a field training in the full option in cluster. There are so many faculties, so we may need to do field training in each cluster. And fourth year will be focused on their career. I mean specific career. Yes. If anyone have anything to suggest me to improve our field training, you are welcome. Thank you. Go back. Slowly.
How did you get such a good community participation in your program? Because in the video I can see that the community is very enthusiastic about participating in this program.
Yeah. First of all, we select the community in a rural setting because the people in rural or semi-urban, they're quite generous. And before that, as I told you, I go to talk with the provincial chief and provincial medical chief officer. So they help us, and then they select the area because the safety comes first. You can do the community at community health development anywhere, but safety comes first. Whenever they choose, they may have their system. The police have to go to the village more often. The village headman have to take care for the safety of our students. So that is our approach. And because of Thai people, they are generous.